Hi,
Hello.
everybody. Welcome to another episode of the Plastic Surgery Perspective.
Yes, and I am Nurse Fonda, as in Nurse Fonda LLC.
And I am Nurse Ebony, aka the Unicorn Nurse. So, today we are going to get into a couple things as far as surgery. So, everybody knows we've had surgery. We went to Miami. It's no secret.
Mhm.
I went. Okay,
Yes, we
Dr.
did.
Didi. I know you're watching. But I went to Dr. Cliff Cannon and I had Lipo 360 and a BBL.
I went to Dr. Joseph Skurlock. At the time, he was at Avana Plastic Surgery, but he now has his own private practice called Fusion Plastic Surgery. So kudos and congratulations to Dr. Skurlock. You can look him up. It's SCURLOCK. I had Lipo 360 with a BBL with him, but that was not why I went. So I went because I wanted a tummy tuck.
Mm-hmm.
But when I got there, he was like, oh, no. So he was like, I didn't have a lot of loose skin.
Mm-hmm.
He said that I needed a round of lipo first. And so I was like, I was kind of devastated, but I was like, oh, okay, we'll just do the lipo first. He was like, you need a good round of lipo in 1st. He said, and then you can come back and get the tummy tuck later. And I was like, okay, cool. So we did. Wait. So when he was doing my evaluation, he was like, well, turn around. Let me see your backside. Let me look at your back. And I was like, okay. So I turned around. He was like, oh. He was like, you have a nice, butt already. And he was like, I said, yeah. I said, it's okay. I didn't really like the way it was shaped. And so he was like, well, we can add a little bit across the top where you feel like it's flat at. And I was like, okay, let's do that. And so that's what we did. We did the Lipo 360 with the BBL. But I went for a whole tummy tuck. But it's cool because I'm definitely going back for my tummy tuck. I have booked with Dr. Fasusi here in Atlanta.
Okay.
Listen now, his tummy tucks, baby, is flat out gorgeous. Okay, they are amazing. So it's booked for April the 15th, but I'm definitely going to change it. I'm gonna have to move it.
Why?
So
Go, friend.
I'm kind of over my BMI a little bit. You know what I'm saying? You have to get that BMI down. So I got to get my BMI down.
We got to stop going to brunch and lunch and dinner.
Listen, that's my weakness, And not just that, but I think with us being post-op providers, we be so busy.
Amen.
So during the week, my eating habits just
flop.
Mm-hmm.
Meal prep.
Yeah. Mm-hmm.
You like, whatever.
Okay, I try, but Lord, you be so busy with the post-op world, everything is so last minute.
Yeah.
So you don't really have time to plan out your days like that.
It's kind of hard, especially when you're providing care for somebody and at any drop of the dime, the surgeon could change the time of the surgery. The appointment time could change. The appointment can go from being 1 hour to 4 or 5 hours, and then you're stuck trying to figure out what you're going to eat in between. So,
right. So let's talk about surgery time and the pre-op time.
Expectations versus reality.
Listen, people. Baby. Listen to me closely. Every major surgery center that I have worked with, except for maybe Goes, all the other ones, you will not get your report time until the night before. Stop calling them people 2 weeks in advance. I'm going, what time I got to be there? Listen, it does not work that way. I'm talking about from Atlanta to Miami to Houston to
wherever,
Virginia. Listen, because we've been just about everywhere. It does not work that way. Mm-hmm. That's just not how they operate. So here's my logic from what one girl told me. So you get your pre-op appointment, right? You go to pre-op and they take these pictures of you. Mm-hmm. At the end of the day, from my understanding, some of the doctors, they take the pictures and they line them up.
Based on easiest to most difficult.
Yes. Yep. And then they say, okay, I want to do her first thing in the morning. I do her next. Now, some of the doctors, I can kind of guess with the girls. I can kind of look at them and go, you a little petite. You only getting lipo. You probably going to be the first thing in the morning. Your third time probably going to be about 5 a.m. or 6, maybe 7. And I'm normally kind of spot on depending on the doctor, but yeah, it doesn't work that way. Yeah. I've had girls text me 2 or 3 weeks in advance. I still don't know my time. I don't know what they doing. And it just, it doesn't work that way, y'all.
Well, Goals is pretty good at it in smaller plastic surgery clinics. You have to realize if you have a plastic surgery center that is doing 1 million girls a day, I'm over exaggerating, but
right.
Versus a doctor that's doing 2, you're going to have a more specific time. It's going to be a little bit more organized. Mm-hmm. And even with the post-op appointments, like I had one lady, she's like, hey, this is my appointment time.
Yep.
I'm gonna be out an hour later.
Yep.
And no, baby, that's not
That's not how it works.
4 hours later.
Yeah. Yeah.
Coming out.
It
It's
is
so
It
crazy.
is surgery season. So if you're having surgery within the next couple of weeks, I say within the next 2 or 3 months, be patient.
Yes.
These places are swamped.
Yes.
It is taking forever for these post-op appointments. If you have massages booked at these places, take you something to eat with you. Take you something
Your pain
to drink.
medicine.
Take your pain medicine before. Please make sure you get a good breakfast. Not, don't just try to throw something quick down. Make sure you sit down and eat a good nutritional breakfast before you go up there, because you don't know how long the wait is going to be. And if you do not eat before you go up there and try to get a massage, baby, you will hit the floor. Okay? You will pass completely out.
They will not catch you.
One girl said that she...
I ain't gonna lie though.
Listen. Let me tell you what one girl said. I'm not calling no names, but one girl said that she was fainting and she went to lean forward because the doctor was in front of her, and she said he backed up.
But let me tell you something.
So listen, make sure you eat.
Make sure you eat, because baby, if you bigger than me, it's nothing Nurse E could do. I'm gonna try to help assist you to the ground, but if it's if it's just too much, it's only so much I could do without hurting myself.
Yeah. So definitely make sure you eat before you go. Hydrate yourself, most definitely. Oh, I know a lot of people want to take Percocets before they get a massage. But if you're taking the Percocet and your blood pressure's already running low, then they're doing the massage, they drain the fluid out of you, you're going to pass out. It is best to take Tylenol before your massage, right? Not the Percocet. People are like, well, it's going to hurt so bad. First of all, if you're getting a massage at the surgery center, they only 15 minutes.
10 minutes.
They like 10, 15 minutes. So it is best to take Tylenol before your massage appointment. Then when you get home and you eat something else, if you want to take a Percocet, then you can. But it's best not to take it before going to the surgery centers for your massage.
And post-op hack. When you're feeling like you're about to pass out, alcohol swabs.
Yeah. Sniff it.
Yes.
Most definitely. So add that to your Amazon list. Go ahead and put some in your cart and put them in your pocket. Put them in your pocket. So that way when you walk in, just pop it open and
sniff
it. You'll notice a huge difference. So yeah, those are just some of the things, to kind of look out for as you are starting on your journey. Whether you're coming here to Atlanta or if you're going to Miami, just make sure that you are prepared. I hope everyone finds them a really great doctor. So keep watching the podcast too, because we got some really good doctors coming up.
We do. So when it came to sitting, how long did Dr. Scurlock recommend for you?
6 weeks.
6 weeks.
And I did my whole 6 weeks.
You did your whole bid.
Yeah, I did my whole bid. I kind of chill. I think I was getting ready to lie, but my body was like, did I do my whole bid? I think I did. I think I did my whole 6 weeks.
Yeah.
Now, I will say when I got back from Miami, I had to take my daughter to school. And so I had to use my BBL pillow, and that was so uncomfortable.
Of course. I know Dr. Cannon, he recommended 8 weeks for me not to sit, and I followed it. I stayed in the house. I was so scared. I tried to drive it those 2 weeks. It was terrible, y'all.
Yeah.
And then after that,
oh my God, it was so uncomfortable.
And I had my BBL pillow, and it was so crazy because I'm thinking I'm doing right. I put my BBL pillow in my truck. I got ready to go to my little massage that was literally up the street. Couldn't even make it to the red light up the street from my house. And I called my ex. I'm like, come and pick me up. He walked up there. I didn't even make it that far that he could walk.
Oh my God. It was hurting that bad?
Well, I almost, I fell off my pillow.
Oh no.
Yeah.
What the word?
You know how I drive.
Come on now.
Babe.
You fell off the pillow?
I fell like this, and my little seatbelt, in the truck did the automatic lock thing, and then went into my thigh. It's just terrible. It was terrible. I cried that whole day. I really
Oh
did.
man.
And I think that was like the only time I really cried. But for some reason, it was just a lot that
It
day.
was a lot.
It was a
Oh,
lot.
and get your 2 BBL pillows. Let me tell you,
Yes.
there's nothing worse than getting to the car and realize the BBL pillow was in the house. I was like, so you know what? I lied. I did not do my whole bed because there was times I had to take my daughter to school and that BBL pillow was upstairs in the house. I said, baby, this is go because we was already running late. I was like, come on. We got it. I don't have time for this today. So yeah, get your 2 pillows, one for the house and one for the car.
And then I always recommend, I had like a one to go underneath my back. I don't know if y'all can see this. So it's like right here. So when I was in my truck, I would still be
sitting up.
stable.
Mm-hmm.
Even though that one time, I don't know what happened. I turned too fast. You know, I got a little heavy foot. But it helped me get through the airport too on the plane ride.
Oh, the
For
plane
takeoff,
ride. Did you get
yeah.
on your knees?
So for the initial takeoff, I was on my BBL pillow with my back roll pillow right here. But when I went to have my surgery, it was still COVID. So we were still skipping seats. So it was me right
Oh,
here, a skip seat, and then my sister. So after takeoff, I just leaned over in her lap. Thank you, sister.
Oh.
So yeah.
Okay.
So mine was pretty easy.
Yeah, I didn't do any of that. I sat on my BBL pillow, popped me a Benadryl, and I slept.
Really?
Yeah, and by the time I woke up, it was time to get off the plane. Cause I mean, from Miami to Atlanta is only like an
It's-
hour
yeah.
flight. Yeah, so it was quick.
Yeah.
So yeah, by the time, but you know what? For some reason, I always fall asleep on airplanes. Like I don't even make it to like takeoff.
Well,
I'll be gone.
Well, I do make it through takeoff because I want to make sure we take off
Oh, yeah, I
appropriately. So,
I'll be asleep.
so once we get up there and we soaring, then I'll go to sleep.
So our special guest is here.
Yes.
Hey, come on in, special guest. It's okay. Just come jump right on in, girl. Oh, yeah, it's okay. You look so cute.
Nice to meet
Right
you.
here.
We can't move.
Yeah.
We're under strict instructions not to move. He don't want us to mess up nothing now.
Yeah. Come on in, have a seat, girl.
So happy to be here.
Hi, nice to
Hey, you
meet
look
you.
gorgeous.
You look beautiful, Ebony.
Yeah, girl. All right. So introduce yourself.
Okay, this camera right here?
Yeah.
So I'm Egypt. I got into plastic surgery I got into this world by kind of just wanting to have plastic surgery. I'm sorry, I'm so nervous.
It's okay, calm down. We having a regular
Listen, yeah,
conversation.
Okay,
we just
okay.
talking it up.
It's nothing.
Okay.
We're just girlfriends shopping it
Yes.
up.
Okay. So you wanted me to just like give my age, what I do?
Yeah, whatever.
Whatever.
Okay, so my name is Egypt. I recently turned 29 last week.
Oh.
Belated birthday.
Pull this up and make sure you speak into it. We were told to do that.
Okay.
Okay.
you go.
Yep.
Okay. So my name is Egypt. I recently turned 29 last
Okay.
weekend.
Happy birthday.
I love everything plastic surgery. So
Yes.
I'm super excited to be here, super happy. How I kind of got interested in plastic surgery was just, I was very young. When I had plastic surgery, I was like 22, 23.
Okay.
And I was just looking at things on my body that I didn't like. I used to work out a lot because I'm prior military. And it's just like, once I got out, stopped working out, it was just still things that I didn't like that got worse because I stopped working out. So I was like, okay, I'm going to get surgery. So I heard about liposuction. And I was like, wait, they could move the fat? But no, for real.
Sound like a deal to me.
Right, sound like a deal. But then I heard like not only could they move the fat, they could put the fat in your butt. So I was like, hold on, so I can like grow this?
Yes.
So I had plastic surgery, and that's kind of where the journey started for me.
Okay.
Okay.
So tell us about your round one.
Okay, so my round one, I pretty much had everything done like in Miami. My round one.
So did we.
Yeah.
Yeah. Okay. Good. Well, I had some stuff done out the country. We'll get into that.
Okay.
But so my round one was at Mia Aesthetics. Doctor what's his man name? Dr. Palladino was my doctor.
Okay.
Oh, okay.
But they did like a little switcheroo because I wanted Dr. What was his name? Alvarez, the man who was doing like the real
Dr.
good boobs at the
Alvarez,
time.
yes.
My mom, she had called me. She was like, Tiana, I saw this girl body and you need to go to this doctor. So I was like, okay, I'm gonna go to that doctor. So I booked everything, got there, and they pretty much pulled the switcheroo. And they was like, well, this doctor is booked. You could do this doctor, Dr. Palladino. And I had already taken off the time from school because at the time I was in college. So I had took off the time from school. Went out there. My mama done took off work because she about to take care of me. So I'm like, I gotta have this surgery. But it was kind of like, looking back in hindsight, I wish that I wouldn't have just, went with him because I wasn't.
Miami is good for doing that though.
Yeah. They do that all the time.
They do that all the time.
They do that all the time. And it's like, now that I know and I see it happen, I'm like, oh, they do that all the time. But
All
at the
the
time,
time.
I didn't know. So your makeup look really good.
Oh, thank you.
Your makeup look good too. I like the
you
hair.
so
Okay, y'all
much.
cute or whatever. But yeah, so I just was like, whatever, I'm gonna do it. So I went to Dr. Palladino. I was not really happy with his results. Now I'll be seeing some of his results and I'd be a little salty because I'd be like, you could have did a little bit of that
He was
for
practicing.
me.
He was practicing.
I feel like I was one of the introductory girls because my surgery was $3,000, and it's like,
But you know what?
he was building his clientele.
I was an introductory girl with Dr. Cannon. It was so cheap, but he did really good.
He was
Yeah.
just
One
starting out.
round, yeah.
Yeah.
and I love that for you. Me, that just wasn't the case for me. I was like, oh my gosh. I feel like I should have gave it a little bit more time, but like if I was to show y'all pictures, and I ain't come prepared with the pictures, all
okay.
that. But
That's
if I was
okay.
to show y'all pictures, I wasn't happy, and also I was young too, so I was in that mood where I was like, I want the hips, I want the tiny waist,
All
baby.
of
Give me
that.
that Vixen, okay? Because I'm young, I'm trying to be outside. So right. So 3 months later, I went to Dr. Dobek, and
That's who I was
okay.
initially booked for, and I got hit with the switcheroo.
Really?
Yep.
Well,
And
she
then they
ended
told-
up getting really sick.
Yeah, she ended up getting really, really sick, and they
Yeah.
kept putting it off, and then finally they were like, "We will let you go to Dr. Cannon." And I'm like, I'm not paying the same price now. I don't even know him.
right, right.
And then so it was cool.
When was this? Like around
This
what year?
was right after COVID when they opened back up. It
Okay.
was January 2021.
Okay.
Yeah, I had a
Yeah.
girl that was gonna go to Miami and stay with, and she was booked with Dr. Dowback as well. But she just continued to get sick, and so she ended
Yeah.
up switching to another doctor as well.
Yeah, I love Dr. Dobek.
Yeah.
Dowback. I don't know how you say it to this day, but I love her. I went to her 3 months later. Now they make people wait like
Girl,
what is it like
3 months?
3 months because
No.
yeah.
But you know what? In sometimes the DR they'll do that.
3 months.
Mhm.
That's crazy.
But I want to say that was back then. So now they have the standard of like, what is it, 6 months,
6
a
6
year?
months to a year.
Right. That was not the standard back then because before I decided on Dr. Dobek, I was going to Dr. Chang at he was at Spectrum at the time. I looked at a few different doctors in Miami and they all were like, I don't know if they were just trying to get money or what, but they all were like, how long ago was the surgery? I was like, 3 months. And they was like, oh yeah, you're fine. So I don't know what made them change it now.
Something must have happened.
Yeah.
Right.
Must have.
Yeah. No doctor was telling me no.
Well, I think now what they're saying is that it takes a full 6 months before you see your real
Results.
results.
Mhm.
So
Yeah,
they feel like,
yeah.
just give it some time. You know what I mean? Because I think that if they go in and add more fat 3 months later and the fluff fairy hasn't come yet, then it may be way too
I
big.
think what it is, people start eating and then it gets bigger. I feel like there is a fluff, but after a certain amount of time, your butt just didn't grow. You know what I mean? Like, how
Yeah.
long do you feel like it takes to see your results? Honestly.
I feel like by 3 months, I feel like that's a standard of where
Yeah.
you don't have that as much surface swelling.
Right.
Yes.
Because I feel like by 3 months, that's why I went and had another surgery. Because I was looking at my booty and I was like, like I didn't like, it was, and I could slap it. It was soft. It was all of that, but it just looked like my normal booty. I was like, where did you put the
Oh.
fat?
Right.
You know? So I was like, nah, I want to have some more.
Yeah.
So,
I feel like my butt stayed the same. And I feel like my swelling, whatever size I had on the table, it never went down, never got any bigger. It just stayed.
stayed the same. But do you feel like it like softened up,
Oh,
dropped?
yeah,
or-
it's real, it's
Yeah.
real soft, yeah.
Yeah.
No, and
She
it
said
never
it's real
dropped.
soft, girl.
Yeah, it's real soft. But yeah, my butt it never went like up and down like that fluctuation. I was just telling one of my daughters that the other day, but I was telling her, through the process, because some girls get so discouraged. They like, oh, the swelling is going down, but sometimes it'll like grow and
It'll
kind of grow as you work out and eat right and
Yeah.
stuff like that. But
Yeah.
My second round, my butt grew. I'm not gonna lie, it grew.
Really?
Yeah, I believe in the fluff area. I think
Yeah.
it's real.
yeah,
Cause so the differences with like my second round and my first round, that's why I feel like my first round doctor didn't do anything because when I went to Dobak, like immediately coming off the table, I
You
saw
saw it.
like even though I was swollen, I seen the hips and I seen the booty. But
Yes.
the way my butt looked, it was like a little bit because of all the swelling, it was like flat and tight. But I saw the shape, and so I was still a little skeptical. But I was like, okay, let's see what's going on. But over time, by like 3 months, it had softened up and like big and just I'm like, oh wow, okay, this is real. Like I
Yeah.
like this.
Yeah.
You know?
Yeah.
Like, girl.
I know, right?
And so what else? What was next?
After the BBLs.
Yeah.
Yep.
So the BBLs were in 2018. 2019. I used to, my weight has always been like up and down. So I went to Tijuana because at the time I was living in California. So I went to Tijuana and I had chin lipo, and then I did the buccal fat pads removals.
Oh.
That's not an experience that I would probably do again, or if I did do it, I did it awake. And a lot of women like surgery awake.
And I just told her last night I would do chin. That's the only thing
would
I
do
would
it
do
awake?
awake is chin lipo.
You'll survive it. You'll survive.
I hope I do.
You'll survive. It's just very like. Do you have bad anxiety?
No.
See, I don't have bad anxiety
Ebony.
either.
I don't feel like I have bad anxiety, but I feel like there's certain things I wouldn't do awake because of the way my brain works.
Right.
I'm gonna hear you say my vital signs. I'm gonna hear this machine going off, and I'm a nurse. So I don't want to do anything awake except for chin lipo, maybe Botox and some fillers. That's it.
But that's exactly how I felt. I felt like, I don't have anxiety. Like, I can do it. But when you hear that, like, cannula, like, buzzing, and it's like, when you go to the dentist, you can hear them doing everything in your mouth. Like, I can hear everything. When he slit my cheeks open, I heard them, like, as if it was a zipper open. And I was like,
girl.
I was just sitting there praying. I'm like,
Oh
God,
my
please,
God.
God, please. To make it worse, it was that
Could you
bad.
put your AirPods in?
No,
Because that's what I do at the
nothing.
dentist. At the dentist, I put my AirPods in and I'm just chilling.
Yeah, one girl,
They don't want
she
you
said
putting
she had
that
took her AirPods to goes, and they tell her, you gotta take them
Oh
out.
man.
Yeah.
Yeah, and like to make it matters even worse. So out the country surgery is like a little different than in the country. So when I went there, it was a line of girls lined up, all trying to get the same thing because he had a special. I think it was like $1,000. And when I had contacted him, he's like, "I'll take $100 off. You come for $900." I was like, "I'm going." So,
Oh my God.
so it's like a line of girls. Everybody just watching you go in, and it's like he called you. He's like Egypt. So I go in there. And then after he do the procedure, like they wrap you up, I come out, everybody just staring at you come out. Like, it was like, oh my gosh, and your face is just so swollen. So I was like, oh my gosh. Like, I was so embarrassed. But at the same time, I was like, hopefully I'm snatched. But I think it paid off.
Yeah,
yeah,
it looks
you look
good.
real
It looks good.
So how was the pain?
I didn't feel anything during the procedure.
Okay.
Pain. I don't really remember that being like a very painful procedure. I just remember being like sore afterwards, like healing.
okay.
But they give you
Right,
like
right.
painkillers,
Yeah.
antibiotics, all of
Yeah.
that. But I don't remember it being painful.
Oh, okay.
The only thing that probably was painful was the numbing. It's kind of the same thing they do for the dentist, like that big needle with the
I can't
anesthetics.
see.
but
They come
hate it.
as soon as they walk towards me with that needle, I be like, put me to sleep.
Yeah.
Girl, you was the worst.
I gotta be put to sleep for everything. My tooth being pulled, honey, knock me out. I can't
I
do
would
nothing.
never do it again awake for sure. It's very nerve wracking for sure. That's why I don't know how people be like, I'm gonna get my whole lipo and body done. Like,
Oh yeah, all the time.
I couldn't do it. Sorry, my nose is like
Oh, you fine.
edit that
Yes.
part out.
Oh my God. So then what was next?
Okay, so after that, I did my breasts.
Which they look amazing, by the way. I
Mhm.
would have
Okay.
never guessed.
Yeah.
Okay, so my breasts, I went to Dr. Crow in Miami.
Oh,
Okay,
yes.
yeah.
Okay, yeah.
And everybody loves him. My experience with him was not that great.
I had another girl saying,
Really?
It was not that great, and I don't want to like bash him on this platform or any platform, but I paid a lot of money to go to him. Y'all know he was like one of the top, whatever. And the
Yeah,
reason I
most
chose
definitely.
to like pay, he is actually the most expensive surgery
Yeah.
I've ever had. And the reason I chose to like, okay, let me just pay the money and go to him because I felt like I had been through where I had a botched surgery before and I had to get corrected and then come back. And I felt like I'm going to have a one and done with him. Like, it'll
Want
just
to
be
get it right the
perfect.
first
Yeah,
time.
it'll be perfect. And it wasn't. I don't feel like he did my surgery completely. I feel like someone else, like he let a resident doctor or whatever practice on me who was doing a residency. Because when I went into the OR, he told me like, hey, this doctor is going to be here. Do you consent to him watching the surgery? And at the time, I'm just like, yeah, sure. Like, he's just watching, like, okay. But when I woke up and, like, even throughout the healing process, my two breasts healed completely differently. It's like my body just told me they were done by two different doctors. They look completely different. The sutures
I've
look
heard
different.
that. I've heard that
The
before.
scars
With a
look
tummy
different.
tuck, one half of the tummy tuck looks different than the other half.
Yeah.
I've seen that.
Yeah, and, like, even to this day, my left breast, which is the one I feel like the other person did, so I did the Galaflex mesh with it as well, which is supposed to, like, hold the implant
Right.
up. And I feel like I can feel this implant, but I can't feel this implant. So I am actually going to redo my breast, but I've just been like, I'm so over it. That process of healing and not being able to move your arms. I'm like, I don't want to do that just yet.
But the thing is, we were talking about expectations versus reality before you got here. So a lot of people expect this one surgeon to be the one that's giving you surgery. And of course, we all want that. But however, when you sign those papers,
they do what they want.
You consent to another doctor under that doctor's orders or whatever to do your surgery. And a lot of people don't realize that. And I'm not saying everybody does it, but it happens.
It happens. I just think that for doctors, like that needs to be something that's more like pushed to the patients because from a patient perspective, if you have built a name for yourself and I'm looking at these results that you advertise as your results,
that's what I'm expecting.
That is what I'm wanting to pay. I paid him $10,000. So it's like to pay that amount of money.
Yes.
I don't want to now I got to go pay somebody else, something else to redo something or they're not healing together. And then I reached out to him like multiple times in his clinic and they tried to, I guess they was like gaslighting me. They was just like, no, like give it time. I'm like, okay, I gave it 3 months. Okay, I gave it 6 months. Okay, it's been a year. Like, you know, how much more time do you want me to give it? Like you didn't do what you were supposed to do, you know? So that's my opinion on him in that. So yeah. After that surgery, moving along
to the next one.
After that, I recently did a hair transplant. I have a wig on today, but I recently did a hair transplant in January. And I went to Turkey for that. Okay. And I agree with what you said, where the doctor doesn't do your surgery. She just did my hairline, but the rest of the hours, it was just her 2 assistants doing it. That I didn't really care about because I felt like I didn't know what I was getting into when I went over there and it was like a different country and I felt like, okay, well, if they doing it, they qualified to do it. And I was awake the whole time. So like that didn't bother me. Like, oh my gosh, she's not doing this surgery. Like everything felt like cool and I felt safe. So.
Okay, that's cool. And what doctor was this?
I went to Longevita Clinic. The doctor, I'm not gonna lie to you, I do not remember her name. She is like one of the only female doctors, but she have a very thick accent. So I don't remember like what specifically she said.
So let me ask you this. Okay. So that's the total of what, 4 or 5 surgeries? 4, 5? Cost. Did you like save up for them all? How did you do it?
I definitely saved. I worked. I was gifted some money for some of them.
Oh, gifted?
Yeah. It was like a mixture of some things, but in total, I never sat down in total. So my first surgery with Palladino was like $3,500, and then with Doback it was $4,000. Crowd was $10,000.
So we had 17.
Okay. The chin lipo was $1,000. He took $100 off, so $900. And then for my 18. Hair surgery, it was like 21 something. So like, what is that? Like 20?
What was that? 18. So what we at? 21 what? 100 or 21,000?
21. Girl, 2,100. Girl, that's why I went to Turkey.
Because we were talking big numbers last week with
somebody. No. That's why I went to Turkey.
That is really good.
Yeah.
2,100. That's not bad.
It's not bad at all. The only thing.
That's like the cost of what, 2 or 3 wigs?
Right. Good wigs, yeah.
Right.
The only thing that was added onto that was my flight. Like going over there, that was like $2,000. So the whole cost, if we want to include the flight, we could say $4 because you got to get over there. But other than that, I think it was a really great price because when I was getting quotes from doctors here, they were starting at like $13,000 and up.
Yeah.
So I wasn't doing that.
And so where are you with that? Like, how is the hair growth in the area?
So I wore my wig today because I'm a little patchy now, but it's growing in. I see significant growth. I will be honest and say, like the doctor told me ahead of time that she does recommend me have 2 rounds just because of how far back and receded I let my hair get before I even came to get the transplant. She was like, I recommend you get 2 rounds so that you can have the density and fullness that you want. I don't want to go through that pain again just because the initial...
it was really painful?
It wasn't a painful, like as far as the surgery, but the numbing process to get the anesthesia in your head is very painful. And then whatever that anesthesia is that they shoot inside of you is extremely painful. So I don't want to go through that again. So I'm just like, at this point, whatever I get, it's just going to be what I get. Y'all know I was bald-headed. Y'all know I got a little fuzz or something now, you know, so.
Wow. How long did you stay over there? for the procedure?
Too long. I stayed 4 or 5 days, and normally for the package, so I added days onto my package because I didn't know how it was gonna be like flying.
Okay.
With the package, they recommend like 2 days. I don't feel like that's enough, or 2 days, 3 nights, or no, 3 nights, 2 days is what
Okay.
they recommend. I didn't feel like that was enough time to go get a surgery way across the country and come back, so that didn't feel right to me. So I was like, let me just stay a few extra days.
So was the hotel included in your
It was included.
in the 2100?
Yeah, hotel,
What?
transportation, girl. They picked us up in Mercedes Sprinters to and from the airport. So I was like, okay,
What?
listen. And then they put us at a quote unquote 5-star hotel. It was, let me say this,
Quote unquote.
it was the Holiday Inn.
But
Okay.
that's their, that's
Over
their
there,
5
over
star.
there,
Right.
that's
That's
fine.
their 5 star.
And it was a rather nice Holiday Inn. But
Okay.
if you don't want to stay there, I would say just book your own transportation. Like if you, I'm sorry, hotel. If you think about like getting it or whatever. But overall, I have no complaints. They fed me after the surgery and everything. They like really
for
treated me
$2,100.
for $2,100.
Girl, that is crazy.
And that's why I went over there. Look, over here, I would have paid $13,000. Wouldn't even got a granola bar. Like they would have been like, "All right,
A
your
sip of
surgery's
water.
done."
2,100. Girl, that is a. I
It's-
still can't get over that. So the last guy we interviewed, he went to Turkey too for height surgery.
Okay.
But he stayed for 6 months.
Yeah,
That's a
I
long
couldn't
time.
do
You
it.
couldn't do it.
I don't. The people over there, they not that nice. Like my doctors said everybody was nice, but like people was rude. Like they be all walking up on you in the street and stuff. Like
Really?
super
Well,
close.
maybe
They don't
'cause he's
respect
a
personal
man.
time.
And
Yeah.
boundaries and
Yeah.
your space.
Yeah, I ain't like that.
So anything else you thinking about getting or would like to get?
Yeah. So I'm actually booking with the doctor.
Okay.
I'm getting a BBL reduction. I'm planning
Okay.
to do it this year.
Really?
Yeah. I've been talking about getting it for a long time, and I done had a few consultations with a few doctors. But I think this year I'm actually like really gonna do it. Because I think it's time. Like,
And what made you decide to do that? Is it weight gain where it just
You
grew?
feel like it's just too big?
Yeah.
girl, it's like y'all know they say weight gain after lipo and the BBL is different. It really
Mhm.
is.
Most
It really
definitely
is.
It really is. And it's like now I'm on semaglutide, which I have lost like a lot of weight on semaglutide. But I'm about to stop taking it. Because of course it's not long term.
Right.
I want to get the reduction because I feel like in the future. So I've always had hips.
Okay.
I've always had hips, but when I had these 2 surgeries, both doctors added more hips. So now my hips, instead of being like my natural hips that I had, are very parentheses. And it's like I just see them spreading more and more as I age. And then I'm thinking like the older I get, I want to have kids.
Mm.
A lot of that, my back is just like, I feel like it's weighed down sometimes. Like my butt, I can literally lift my butt up like it's heavy. You know what I'm saying? So I'm just like, it's just time to let it go. Like I had my fun with it. I was young. I'm getting older now. So it's time to, you know.
So you talk about age, which brings up this post that I saw. I think it was on Spiritual World. It was like, give advice to a 19 to like 25-year-old girl, right? Said all women give advice. And I was reading through the comments, and one lady said, do not go and get plastic surgery. Wait until you're older. Wait till you have kids because your body is still developing and still filling in. So do you feel like you had the BBLs like too young? Do you feel like your body would have eventually maybe grown into the hips and the butts that you was looking for?
So this is what I'm going to say. If you want plastic surgery and you young, get it. Don't go overboard. I am happy I got my plastic surgery at the ages I did. I started at 22. I was turning 23.
Okay.
I started around that age, and I lived a great life with my plastic surgery. Listen, if you can't relate, I'm sorry. But, you know, as for me, you know, Betsy done been around the world with it, okay? So I don't disagree, but I do agree that if I was younger and like I had the mindset I had now, I wouldn't have went as overboard as I did. Like I
gotcha.
would have done it, but I would have done it in a natural state. I would not have done it as dramatic.
Oh, okay.
Okay.
Yeah.
Oh, that makes sense. That
Yeah.
makes sense.
Yeah.
So do you feel like having the surgeries kind of changed your life?
I do.
Really?
I do. I feel like especially when I was younger, like before, and I keep talking about when I was young because I'm talking about like when I first got it done. Now I done matured, so a lot of stuff I just be like, I ain't even looking at that anyways, you know? But I just feel like before I had my plastic surgery, I was a very attractive girl. I could send y'all pictures if y'all want to put them in your video or whatever, you know. But I just did not get the certain type of men that I wanted at the time. Like I got men, but they were just nice guys, and I didn't really want them, you know. But when I had surgery, I don't know if it was where I lived or whatever. It just at the time it just made me stand out because it was like, who is that? You know what I'm saying? And I just felt like I was
I
that
feel
girl.
like the caliber of men do change.
It changes
After you get your surgery.
And it's crazy
It
because
definitely
I do
does.
feel like a lot of times those be the main ones. They're like, oh, I like a natural girl.
Yes. No.
But
Let's
then when
be
you,
real.
yeah.
Yeah, so this is my thing that I want to say. Men, and like they love to say men want natural women. Men don't care about plastic surgery. That's just my opinion. I'm not a man.
No,
but
they
I'm saying
don't.
men don't care about plastic surgery as long as it looks good and it's appealing to the eye. Men are visual creatures regardless.
Most definitely.
So that's what I'm going to say. I'm going to leave it right there.
So any advice that you would give to someone thinking about having surgery?
Any advice that I would give to anyone, I would say definitely do your research. Don't be eager to just like in a situation I told you about where I was like, I'm just go to this doctor just because I'm already here. Looking back in hindsight, it's like I would just be like, nah, I'm just gonna either lose that deposit or figure something else out. But just don't be eager. Take your time, do your research because this is your life. It is your body. And you don't want to have corrective things to get done. You know what I'm saying? If you do have something that needs to be corrected, at least you could say, okay, it's not my fault because I was eager or I rushed. Like I took the time. I went to the doctor I was supposed to go to. I did my research and they just dropped the ball. Don't let it be any part of a part of that. So take your time, do your research, don't rush. And I would also like to say too, while I'm here, a lot of people say, or how do y'all feel about this? This is my question for y'all.
Okay.
Like people say like, okay, women who get plastic surgery, like we push on other women that you should get plastic surgery.
No.
I don't feel like that.
I don't feel that way either.
I tell people do what makes you happy. Like I was unhappy with how my bottom looked. Everybody in my family has a big bottom except for me. So I did what made me happy and what made me feel good. And at the end of the day, I'm happy with the decision that I made.
Right.
But that might not be the right choice for everybody.
Right.
So do what makes you happy.
Yeah.
I'm the same. I definitely don't push it off on anyone. I went, like I said, I was going for a tummy tuck. I ended up getting lipo with a BBL. And I was doing it because I wanted to look better in my clothes. I wanted to be more confident in the outfits that I wear. And nowadays, I feel like everything is so tight and so fitting that you have to either lose weight, look halfway decent, or the clothes just don't really give. You know what I'm saying? So I was tired of putting on clothes and being like, God, like look at my stomach, look at this, look at that. So yeah, so that's why I did it. But I definitely don't push it off like, oh girl, you need to go see somebody about that stomach.
Right.
Go see somebody about that.
Here's
Now,
my doctor's
in my mind, I might be like, "Ooh, girl, you could lose a little BBL because that little chicken butt." But no, I wouldn't dare. I would not dare insult anyone like that.
But it's so crazy how people that don't believe in plastic surgery are very judgmental and try to push other people not to do what they want to do with their bodies.
Yeah.
So I wish the respect would be mutual. So.
I wish that too. How do y'all feel about like people saying, "Oh, just get it in the gym"? Because like,
oh no,
they be in the gym killing themselves.
I think like, but I think that's just. I don't want to say ignorance, but they just don't understand. They don't understand how the female body operates when you have children. And the things that take place, you know what I mean? And how it breaks down like the muscles and all that kind of stuff. They don't understand loose skin. They don't. So I think they just don't get it. You know what I mean? I think it's just a lack of knowledge. I guess is what I'm looking for. It's the lack of knowledge. So when people, because I had a guy one time, he was like, so you don't think people can just work out? And so we had this long conversation. And at the end, he just was like, oh. You know, he tall and skinny, probably 120 pounds.
Soaking wet.
Soaking wet, right? So he just had no idea. And I think people just, you just don't know what you don't know.
They just jump on the hate train because it's the easy thing to do or it's fun or whatever.
That's the easy thing to do. Jump on that hate train and be like, you could have just went to the gym and got that. No, I could not have.
And I think these trainers take a lot of people's money because I work with a lot of trainers who had plastic surgery, but they telling you to get it in the gym.
Girl, and I'm so glad you said that. That is so true. Like I literally had someone anonymously inbox me one time. And they were like, "Hey, I'm so happy about like how open you are. I'm a trainer, and I've had plastic surgery, and my conscience, whatever. Like, I don't know if I should tell my clients this or not." And my advice to them was pretty much, they're not. This is what I told them. Y'all tell me if I was wrong or not. But I told them, "Are you necessarily obligated to say you've had plastic surgery? No, but I do think that it's kind of false that you are advertising something." That that isn't achievable to them because they're gonna look at you and think, oh, I got this in the gym,
right?
But you didn't do it, Now
there are a couple of girls that I follow that advertise both. Like the one page is
Fit
called the
BBL.
Fit BBL.
Yes, shout out
I
to
like
her.
her.
Shout
I
out
like
to her. Yeah,
Uh-huh.
you know, she talks about the surgery she's had, but how she maintains it in the gym. And there's another girl here too. She had Lipo 360. I can't think of her name. Honey. I can't think of it. Anyway, but she's very open about what she's had done, but she maintains it in the gym. She's really big on working out and things like that. So I think as long as you're communicating about what you've had done and how working out enhances it and really gives you that
It
flat
goes hand in
stomach.
hand with
It
it, for
goes hand
sure.
in
It doesn't.
hand.
Surgery don't cancel out the gym.
I love
People don't
somebody.
think that though. They think, oh, you're so lazy. Baby, I gotta keep this up. Or
gotta
I'm gonna have
keep
to
it
be
up.
back on the table. You know,
Right,
So,
like me.
Yes.
Got to be back on the table, but it's okay.
Right.
Because sometimes that first round too, you just be like, "Oh God, this is a lot." Because it's a journey.
That recovery is a lot. Recovery a
Yeah.
lot. That's why I'm kind of like, I'm about to get this reduction, but do I really? Because I'm getting a little bit more lipo with it too. I'm like,
Okay.
do I really want to do this?
Now, which
let's do
doctors
it.
have you researched for the reduction?
I'm not telling you. I'm just kidding. I'm just kidding. So the doctor who I'm going to is Dr. Blinsky. He is also in Miami.
Oh, okay,
so
okay.
I had a deposit down with Carlos Gomez in Colombia, and this was back in 2020. I was supposed to go to him. A lot of stuff started coming out about him before stuff started coming out about him. My spirit, and I know now it was God telling me don't go, but I had just kept like, before getting on the plane, it was like 2 weeks before, and I had to cancel the surgery because my spirit was just like, don't go. I started having all these doubts, and for months I hadn't had any doubts. And for me, I'm a firm like advocate for do not have any surgery unless you are 100% certain. So I called my mama and was like, everything off, because my mama would be like my surgery sister. Like any
Right.
surgery I have, she gonna go there with me, you know.
Yeah.
But I was just like, everything off. And shortly after that, everything started coming out about him botching people and just about all that that whole drama he had going on. So I was like, ooh, that was God telling me don't
But
go.
it's not a lot of doctors offering that right now.
So let me say this. I have a whole list that I put together that it's a lot of doctors that do offer this procedure. You gotta look for it. You have to research it. Dr. Blinsky is one of the doctors on my list. And I chose Dr. Blinsky because he consistently does them. Like he consistently fixes and reshapes and remolds. A lot of doctors now are starting to try to promote that, if you notice, because they see a lot of women now don't want such
They want the
dramatic.
skinny aesthetic.
And I will say, be careful about just choosing a doctor who's kind of just jumping on that train, because I feel like, my personal opinion, it's more complicated to take it out than put it in, and you don't want to be left disfigured, disformed, none of that. I had a consultation with Dr. Blinsky. He made me feel very safe. I've researched his work. I've seen somebody that that has gone to him, and I feel very confident that he could do the procedure. So I am entrusted. I'm saying it on a plastic surgery perspective.
Okay.
So if anything go wrong, yeah,
You better treat our
I'm
girl right
trusting him
now.
that he can do what he needs to do. So yeah.
All right.
All right.
Awesome.
Well,
Yeah.
So tell us your social media
Yes.
so everyone can follow you.
Y'all can follow me at Egypt Rodriguez.
Okay.
Y'all gonna put the name right here?
Yes.
Okay, y'all can follow me at Egypt Rodriguez. Yeah, for all things plastic surgery and everything else. So.
All
Okay.
right. Well, thank you so
Thank
much for
you so
joining us
much for your
today.
time.
Thank you, ladies.